Research indicates that mold exposure can contribute to psychiatric symptoms, including but not limited to depression, anxiety, brain fog, and insomnia. And today's info comes from psychologytoday.com, psychiatryredefined.org, and restore-mentalhealth.com. And that was my cat jumping down. Psychology Today reminds us that mold illness-related psychiatric symptoms are due to the body's inflammatory response to mycotoxins. And side note, the spores can also contribute to inflammation and mental health issues. Psychology Today goes on to say that, mycotoxins disrupt neurotransmitter function, leading to mood disturbances. And that prolonged exposure has been associated with cognitive deficits such as memory impairment and issues with attention and concentration. They add that toxic mold-based illness is a very prevalent yet underdiagnosed condition that can manifest in a variety of ways, including purely psychiatric. Mycotoxins are able to contribute to neuroinflammation by crossing the blood-brain barrier. This disrupts normal brain function and neurotransmitter systems. They also highlight the stress of living in a moldy environment contributing to mental health issues or even leading to new ones. That's my dog. Mold-related illnesses commonly missed because standard medical tests do not test for mycotoxins. The inflammation caused by mycotoxins can lead to a biological response called oxidative stress, which can cause cell neuron damage. Restore-mentalhealth.com reminds us that spores also release other compounds aside from mycotoxins that can contribute to various health issues, including fatigue, all which can impact mental health issues. But spores can also activate the immune response, adding to anxiety issues and even memory problems. PsychologyToday.com also adds that just the stress of living in a moldy environment and navigating everything, including your health that goes along with it, can drastically increase your stress levels. Psychiatry Redefined reminds us of some of the more basic symptoms. Remember, there's a whole lot more. These are fatigue, persistent headaches, weakness, rash, mood changes, musculoskeletal pain, GI and respiratory issues, attention and concentration problems, and more severe would be tremors, seizure-like symptoms, and even dissociative symptoms or psychosis. These symptoms are often lumped together as medically unexplained. Don't be gaslit. Happy Moldy Monday.